The goal of treatment in general is to get the amount of cysteine under a certain target or to a place where your urine can hold it. So like if you think about my pool example again, your goal is to get to the place where that pool can allow everybody to swim around freely and not bump into each other. So how do we do that? Well, either we make the pool bigger or we take things out of the pool. I mean, that's kind of, take things, meaning patients, or in your case for this example, cysteine. And whatever that is, we have to get to below a point at which the cysteine isn't going to bump into each other, form crystals, and form stones. And so right here, if you take away nothing else from this talk, take away this number, 250 milligrams of cysteine per liter of urine. In general, for most patients who have cystinuria, that number, 250 milligrams per liter, is the target. If you are below that in your 24-hour urine measurement of your cysteine levels, you're less likely or unlikely to form stones. And if you're above that number, you're more likely to form stones. And if you can get yourself below that number, you're much less likely to form stones and change the course of your disease. All right. So how do we kind of think about doing that? 250. How do we get below the 250? Well, there's what I like to talk about is 4 levers and 2 buttons. Button number 1 is conservative treatment or therapeutic lifestyle changes, TLC. And then button number 2 is non-lifestyle changes. So it's either therapeutic lifestyle changes or non-therapeutic lifestyle changes. And there's 4 levers within each one of those. So we'll look at the first 3 on the left. The first 3 on the left are therapeutic lifestyle changes. Diet, which is the first one, is fluid diet. And then you see the one on the right there is specifically the types of foods you eat. And the middle one is pee. So let's talk about diet first. So fluid makes sense. The more you drink, the more you're going to pee, and the more you're going to pee, and sorry again for the lack of better medical terms, but I'm a pee-pee doctor, so it's okay to talk about pee-pee, is the more you drink, the more you're going to pee, and the more you're going to pee, the more you're going to increase the size of that pool for cysteine to swim around, not bump into each other, and not form crystals and not form stones. So the American Urological Association, which is sort of the governing body of urology and urologists in the United States, says that the best way to go for patients who have cystinuria is to make 2.5 liters of urine a day. So in order to make 2.5 liters of urine a day, you got to drink about 4 liters of 4 liters of water. You don't want to drink urine. 4 liters of water, and that's a lot of water. I mean, I've tried drinking 3 liters a day, and I have a hard time with that. It's tough. So yeah, I mean, it's a lot, but you want to try to drink 4 liters of water, about a gallon of water a day over the course of the day, in order to get to a good amount of urine output. But that may not be enough. It depends on what your body is doing with the amount of cysteine that's going into the urine. But that is a really good first start. And here's a good question right on is, does it matter what type of fluid? Water versus sports drinks versus soda? A little bit yes and no is the better answer. I mean, most urologists will say fluid is good. Fluid is fluid and fluid is good. Certainly beer, certain patients want to know about beer. And yeah, beer is fluid. Fluid is fluid and fluid is good. Certain fluids will cause you to urinate more frequently than others. Some will have a little bit more acid versus non-acid in them. But, there's so minor differences that, again, it's just about drink. You just got to drink a lot. And whatever you can do to get that fluid in is really going to be the most important thing. So, yeah, that's straightforward. We want to drink more. The next is your diet. We want to decrease. We'll start with animal proteins. You want to decrease your animal protein because, again, if you eat too much proteins, they're going to be broken down to amino acids, and then it's going to get more cysteine in your urine. So, again, it's foods that are high in methionine, not cysteine, that are the problem. The trouble is there's never been any research that says that one diet versus another is better, how much you really want to avoid the amount of methionine per day. So I think a good thing to do would really be to talk to your doctor about getting you an appointment with a dietitian who can go over with you the different foods that contain methionine in them in high amounts versus the foods that contain methionine in lower amounts, and give you a sort of a goal target to the amount of methionine that would be good to eat. For you, based on your size and your weight and the amount of cysteine in your urine. So I really can't go over that here because I think everybody's a little bit different. But in general, you certainly do want to limit the amount of protein that you're eating, any kind, that contain a lot of methionine. Sorry, I can't give you too much more than that. Interestingly enough, though, the bigger problem is not just animal protein, but it's sodium or salt. And it's not just the salt that you would sprinkle on your food, when you're eating, or the salt that you sprinkle into your food when you're cooking. It's the preservatives. And the American diet is full of preservatives. Unfortunately, you go to the lean cuisine and you have a lean cuisine chicken parm that's been in the freezer for a year, and it'll stay another year in the freezer. How do we do that? It's because you put a lot of salt in there, a lot of preservatives. And those preservatives prevent them from extra moisture getting into the foods and bacteria from growing and molds and fungus and all that stuff. And so that's why it's there, and we eat it. And unfortunately, that's the liquid preservatives that are killing Cystinuria. Salt is directly related to the amount of cysteine stones you form. The research is very clear on that. Patients don't realize it, and it's 2,300 milligrams per day is the goal. If you go look at a lean cuisine, which is supposed to be healthy, it probably has 40 to 50% of the amount of salt you're supposed to take for the entire day. So you really, really got to pay attention to the amount of salt, especially liquid salt. Here's a question. I was told Crystal Light was really be good because of the citrate in it. So hold on that question for a second. So that's the third lever of therapeutic lifestyle changes, increasing your urine pH. If you can increase your urine pH, you're going to be able to have more cysteine float around freely in your urine. Some people do that by taking uracil K or potassium citrate. Others can't tolerate it. And the only really good way to know if you're getting what you want to get out of that result of that medication is to measure your urine pH either through a 24-hour urine or a urine dip, depends on what your doctor wants you to do. So, all these three levers are the critical factors to therapeutic lifestyle changes. The measures that you can do before, you go on to another step of adding a medication like Thiola. And so, question here was Crystal Light. I was told it's good because it's got a lot of potassium citrate in it. It does have some more citric acid than other drinks, but whether it really makes your urine pH change a lot or not, still sort of, some people say yes, some studies and people say no. And so, if you're drinking lots of fluid and you're drinking Crystal Light, that's not bad necessarily in terms of getting your pH to change. Maybe it will a little bit, but maybe the artificial sweeteners in it could be a problem. So, that alone is, it's hard. It's really hard to say. We could talk about that on another call. Patient wants you guys all to know that there is a ton of salt in tofu. So being a vegetarian doesn't necessarily mean that you're avoiding problems with cystinuria because you cut out animal protein, because a lot of vegetarians and vegetarian diets are very high in salt, and that's a very good point. Okay, so those are your conservative or therapeutic lifestyle changes. First, increase your fluid intake to make more urine, to pee more, get your urine pH up, and manage or decrease the amount of animal protein and sodium in your diet. But in 55% of patients, out of one half of patients who are doing everything they possibly could for therapeutic lifestyle changes, they still form kidney stones, which means that it's not going to be enough for every patient. And that's when you need to go to a medication like Thiola. And that's where it's really important that when you're on a medication like Thiola, it's a dynamic medication, that you're talking to your doctor, you're getting your 24-hour urine test, and you're seeing what your urine cysteine levels are so that am I above 250 milligrams per liter? Am I below? And what can I do with my doctor to change that to try to get those numbers down so that I'm below 250 milligrams per liter?
Please see important safety information on screen and full prescribing information at thiolaec.com. Thiola EC is a prescription medication provided in a delayed-release tablet. It's used in combination with high fluid intake, alkali, low acid, and dietary changes to help prevent the formation of one type, cysteine, of kidney stones in certain adult and pediatric patients that weigh at least 44 pounds, 20 kilograms, and who do not respond to these measures alone. Thiola EC should not be taken if you are allergic to Thiola EC or any of the ingredients in Thiola EC. Thiola EC may not be right for you. Before taking Thiola EC, tell your doctor about all health conditions you may have and any medications you may be taking. If you're pregnant or plan to become pregnant, if you're breastfeeding or plan to breastfeed. You should avoid drinking alcohol 2 hours before and 3 hours after taking Thiola EC. Serious side effects. Thiola EC can cause proteinuria, high amounts of protein in urine, including serious kidney problems and hypersensitivity reactions, including fever, rash, joint pain, and enlarged or swollen lymph nodes. Most common side effects: nausea, diarrhea or soft stools, sores in the mouth, rash, fatigue, fever, muscle or joint pain, high amounts of protein in urine, and vomiting. These are not all the possible side effects of Thiola EC. Call your doctor for medical advice about side effects. You may report negative side effects to Travere Therapeutics Medical Information at 1-877-659-5518 or to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information available at thiolaec.com for additional important safety information.